In this video, we will discuss the COVID-19 timeline. It is important to understand that many people experience COVID-19 differently, but we have put together this presentation to illustrate some of the common timings that doctors have observed. Let's look at this graph. The x-axis along the bottom is the timeline in days starting with exposure, or when someone is first exposed to the virus. We will call this day 0. The y-axis up the side shows the viral load, which is the amount of virus in an infected person. After you are first exposed to a virus, it will replicate in your body and the viral load will increase. As the viral load increases, you become infectious, which means you can get other people sick. At this point, we think that people infected with the SARS-CoV-2 virus can infect others early on, starting at about 2 to 4 days after exposure. Half of people with COVID will show symptoms 5 days after exposure while they are still infectious. Some people will have symptoms in only 2 days, while others may not show symptoms for up to 14 days. This is why if you've had close contact with someone who has COVID, you are supposed to quarantine for 14 days. At the end of 14 days, you will either show symptoms, or if you were infected but had no symptoms, you likely won't be infectious anymore. This area here in red is a very important part of the timeline because people can spread this virus to others even before they know they are sick. This is why it's so important to wear a face covering when you are around other people who aren't in your household. You may be infected and not know it, either because you don't have symptoms yet or you don't develop symptoms, but you may still have a high enough viral load in your body to infect others, and they might develop a much more severe case of COVID-19 than you. Back to our timeline. Once you have symptoms, you need to isolate for at least 10 days so you don't get others sick. You can only end isolation if it's been at least 10 days since your symptoms first appeared, your symptoms are improving, and you haven't had a fever for at least 24 hours without the use of any fever-reducing medications. At this point, 10 days after symptoms first appeared, doctors think the viral load has been greatly reduced and it's unlikely you will get others sick. It's important to talk with your healthcare provider about when you are able to be around other people. Some people will still experience symptoms like loss of taste and smell for weeks after they have been cleared by a doctor to end isolation. So even when the virus is gone, the recovery period will continue. For more severe cases of COVID-19, other symptoms develop and the timeline is extended. People with severe cases are also infectious for longer than those with mild cases. The timeline will start the same way, with exposure at day 0 and then increasing viral load as the virus replicates in the system. Symptoms may still appear around day 5 or anywhere in that 2 to 14 day window. But for severe cases of COVID-19, people experience more serious symptoms. Doctors have reported that around day 10, people with these cases may start to experience difficulty breathing, which can worsen and turn into acute respiratory distress syndrome in another few days. Most people that need to be hospitalized for COVID-19 are admitted about 2 weeks after exposure. For those that survive, they are usually released after an additional 2 weeks has passed. It's important to note that especially with severe cases, though, the timeline can be very different for people based on their individual case. And again, some people will experience symptoms for weeks and months after their COVID diagnosis. These people are now being referred to as long haulers and may struggle with loss of taste and smell, fatigue, shortness of breath, and heart damage even after the virus has left their system. At this point, it's still too early to understand all of the long-term effects from COVID-19. It is crucial you do everything you can to protect yourself and others. Maintain 6 feet physical distance from others, wash your hands frequently, wear a face covering if you are around people not in your household, and stay home when you are sick. If you have any questions, please contact us and visit our website for additional resources. You can also check out the CDC's website for resources and the most up-to-date information on COVID-19. We will include links below to CDC pages with information for quarantine, isolation, the clinical presentation and progression of COVID-19, and other frequently asked questions.